Hello, everyone, and welcome to our panel discussion where we are talking about the intersection of race and disability. We are thrilled to have you join us for this very important conversation. I am Carla Smith. I'm the Chief Clinical Officer at Motivo. And just real quick, for those of you that are unfamiliar with Motivo, we are a virtual clinical supervision platform. We have a network of about 800 clinical supervisors, and we partner with behavioral health organizations to provide quality, accessible clinical supervision. We are super excited, as I said, to offer the CE credit for today. So just so you know, our session has been approved by the National Board of Certified Counselors for 1.5 CE credits. In order to obtain those credits, you must complete the survey that will be sent as a follow-up email as well to verify your attendance. We have three incredible panelists to lead our conversation today, and they will be introducing themselves as soon as Meryl Friedman of Anthem kicks us off.
Great, thank you, Dr. Carla. Welcome, everybody. Greetings. I think everybody is pretty much in the afternoon at this point at 4 o'clock Eastern. My name is Meryl Friedman. I have the pleasure of leading our inclusive policy and advocacy here at Anthem, and of course, partnering with Motivo and collaborating with all the speakers that are on the line today. I am sitting in a conference room, so you'll see some older 1960s plus wallpaper and some food behind me. So forgive us. We tried to find a quiet space. I have short, curly pepper, a little bit of solitaire, wearing a black shirt. My pronouns are she and her. Very grateful for everybody to be here. So we're thrilled, right? You've chosen to spend your time with us this afternoon. I think you're going to enjoy the discussion greatly. As we have evolved this particular forum, this series, we just really keep saying how important it is that we keep coming together and like having deeper conversations about racial equity. And today being able to dig much deeper into what we're calling exploring the intersection of race and disability. I myself identify as neurodivergent with ADHD. And throughout the forum today, we will remain inclusive of all disabilities, people with mental health disabilities, physical disabilities, intellectual and developmental disabilities, and even, people who encounter disability as they age. You'll hear the panelists talk about intersectionality and what that means. And I will stop myself from diving in and leave that to our super awesome panelists for you to hear from. Thanks to everyone who included questions in the registration. We do use those to shape the content of our discussions. You'll hear them be referenced and responded to throughout, but please use the chat as well for questions, and we'll be bringing those into the discussion and just continuing to learn and share from each other. Lastly, as Dr. Carla started to tee up, if you stay on at the end and fill out that quick online survey, you will get your 1.5 CEs, but also please provide feedback, right, on how the discussion went, those things that really resonated with you, things you may want to hear more from or think other people should hear more about, or any reframing. Just tell us what you think. Enjoy the discussion. Thanks again for being here, and I'm going to turn it back over to my friend and colleague, Dr. Carla Smith, who's moderating the discussion.
Thank you so much, Meryl. So we chose not only this topic intentionally, but also the date intentionally. Today is the anniversary of the Olmstead Act, which actually required states to eliminate unnecessary segregation of persons with disabilities and to ensure that persons with disabilities received services in the most integrated settings appropriate to their needs. So this conversation is very important. It's not only timely, it's something that we don't do enough of, especially in the healthcare system. And so our three panelists are geared up and ready to really help us better understand and to dig in deeper to a topic that is a long time coming. So I'd really love for our panelists to introduce yourselves and to tell us why this topic is important for your lens and framework. So Tawara, would you be so kind as to start us off with your introduction?
Thank you, Carla. And also thank you very much, Meryl, for this invitation to join you today. I'm Tawara Good. So I describe myself as an African-American female with rich brown skin, natural locks. I am wearing glasses, a purple dress because it's warm in Washington, D.C. today, a necklace, and I think that's pretty good description. Mixed gray hair. Okay, have to put that in. So why am I joining today? Well, first of all, just a generous invitation. But as I think about this topic, most of my professional career at Georgetown University, where I am an associate professor and director of the National Center for Cultural Competence, as well as the University Center for Excellence in Developmental Disabilities. So I would say that most of my professional career, and it's been a minute, okay, so it's been a long time, has really focused on the nexus of race, ethnicity, disability, language spoken, and other cultural identities, and how they impact health and well-being, but also looking at it in terms of how it manifests and the disparities that we see, whether that's disparities in health or mental health or other social determinants of health. And so that's what brings me here today.
Thank you so much, Twara. Cynthia, would you be able to introduce yourself next?
Absolutely. First of all, I just got to say thank you so much for having me on this panel. I love Anthem. I love the work that you're doing. And I just so appreciate that you all are having these really, really important and sometimes kind of tough conversations. So I am joining you from New York City, which is the original homelands of the Lenape people. I'm just visiting here. I am just now noticing my room is starting to get pretty dark. I'm in time in school, so I'm expecting a lot of light to come very soon with all the lights outside. Let's see. And you know what? It looks like I'm frozen. Am I frozen or can you see me? Is everybody else just really still?
You're going
Okay.
in and out,
Okay.
but you're good right now.
Okay, all right. So I'm sorry about that. So I have brown skin with curly hair. I'm wearing a beige top. I have spent much of my career working in the disability space. My dissertation focused on how college students with disabilities use technology to engage with their learning environments. And since I finished my doctoral studies, which was about 15 or so years ago, I've worked on a lot of federally funded projects, really focused on accessible technology as well as assistive technology. I've done a lot of policy work in the disability space. I was the lead researcher for 3 congressionally mandated reports to the White House and Congress for the National Council on Disability. Now I work for a racial justice organization called the K-4 Center, which focuses on advanced inclusion and belonging in the tech workplace in particular. I am actually in the process of launching a certificate program for diversity, equity, inclusion, and belonging professionals in tech. And it's really important to me in this conversation, is important to me. Because I have been disabled for 5 years of a physical disability, which impacts the way that I walk. I was paralyzed for a period of time as well. I've been disabled for 25 years. I've been Black for 50 years. And I think that my identity and how I show up in the world has really shaped the experiences that I've had. I feel as though I'm very fortunate in many ways in terms of an accident of birth, the family that I was born into, which really was very strong in terms of advocating for me and pushing education. However, I think there are a lot of people who look like me who don't necessarily have the same type of support, which I think can impact opportunities that they have. And so,
All right. It does look like we have lost connection with Cynthia. There you are. Can you
My
hear us
hope
okay?
is that I can. My hope is that I will continue to drop call. Internet service, but essentially that's my background in a nutshell. And I just really appreciate the opportunity to speak with you all today.
Thank you so much, Cynthia. I do want to let you know that your audio is going in and out. So I'm not quite sure if that is something that can be fixed at the time. We also have learned that with technology, especially over these last couple of years, that, it just is what it is. So yeah, I will
Well,
make sure
you know
to
what?
let you know when that happens. Yeah. Okay. So I'm going to go ahead and ask Christina to introduce herself and to let us know about, first of all, thank you for being here, and to let us know about your work.
Thank you, Carla, and happy 23rd anniversary day of the Olmsted decision. It's very exciting to be presenting today, and also equally exciting because today is my first time presenting on behalf of Anthem. I joined today's conversation after 23 plus years in the independent living network of the United States and the world, and have been now with Anthem for almost a month on Saturday. So very excited to be here today and being here on the Olmsted anniversary to have this conversation. I'm like to call myself a young middle-aged woman with brown and gray hair. I have olive color skin. Today I'm wearing a black long sleeve top in a very cold hotel, and I have an orange background. A little bit about myself. One of the things that I think is really important about independent living and where I come from is about the personal experience and what you bring to the conversation as having lived experiences and personal experiences. And with that, I was born to a family of a teen mother who was hardly 16 years old. And fortunately, my grandfather was a Marine, so I was born on base. So we had some sort of health insurance. But I was also the first in my family, my mother's family of 9 children, to be born. So I'm the first of the grandchildren and first to have graduated from high school and gone on to college and graduated from college. There's been a lot of experiences throughout my life growing up, but then also becoming a parent to children with disabilities and marrying a husband with a disability as well. So I bring all of that experience to today's conversation and look forward to talking with you.
Thank you so much. And I'll just tell you all a little bit more about me. I am also a Black woman. I have, I guess, medium length, curly, coily hair, black hair. I am wearing glasses and also am wearing earbuds so that I can hear better. Personally, I also do I live with a what's considered an invisible disability, and that I have severe anxiety. And so mental illness is also something that is important to include into this conversation. We also would like to be inclusive of neurodiversity as well as autism spectrum disorders. And so as we really talk about and dig into terminology, I think that not only as we talk about disabilities and also race, but also both at the intersection, one of the really hard parts around having conversations at the intersection of disability and race is that we often are going off of misunderstandings of terminology or are not inclusive in our language. And so oftentimes this can cause, I know for me personally, it can cause, a sense of, what if I miss something, or what if I mispronounce something, or what if I say something incorrectly? And so personally, I tend to kind of, shy away from conversations where I feel awkward or that I'm going to say something wrong. However, this is the work of being able to provide inclusive care. need to really change the work that we do to be more equitable and to influence equity in healthcare, mental health care, and also disability access and services. So speaking of terminology, I would really love for us to spend a little bit of time around the terminology and first focus on this term of intersection or intersectionality. I think that's one of those terms that we often get wrong. And so I want to spend time here because it's very important that we frame our conversation around intersectionality and to do that in an appropriate way. So Tuara, would you be willing to talk to us and to tell us more about intersectionality as well as its relevance in conversations about equity and access? If I need to repeat that question, please let me know.
You do not need to repeat the question. Thank you. So as I think of the term intersectionality, I will share with you my bias. I am of the Kimberly Crenshaw school of defining intersectionality. Way back in 1991, Kimberly Crenshaw, I guess, gave birth to this term intersectionality. In that work, her critical work that remains with us now, she wrote about how a person, because of their membership in multiple social groups, may experience discrimination, marginalization, and oppression. And her voice at that time, 1991, was really focused on women and specifically Black women. And that was the, I'm going to use the word nexus that she spoke to. Since 1991, the term intersectionality has been used in many ways by many different groups of folks, whether it's health, social services, mental health, and education, etc. However, what I've noted is that many people use the term and they omit something that's really critical and crucial. They omit the harm. They omit the oppression, they omit the discrimination, they omit marginalization. And that is the nature, at least in terms of how Kimberly Crenshaw defined intersectionality. I see this particularly in the disability space among many members within our network, that they're using the term intersection and they're using the term intersectionality in an interchangeable way. I think that they're distinctively different. And I know clearly Cynthia can add some light to that. And I think that terminology is so critical and really very important, but leaving out the most critical part of at least the framework that we use at the National Center for Cultural Competence is that there is harm, there is discrimination, there's oppression, there is marginalization, there's stereotyping for individuals who have these, I'm going to say, multiple cultural identities. And I say that in thinking of a colleague who describes himself as having multiple cultural identities. And those identities are male, Latino, a member of the LGBT community, and disability, and describes those multiple cultural identities as these are all part of who I am. Please don't ask me to separate them. However, when he describes experiences of intersectionality, uses the same things. So he will speak to male, member of LGBTQ community, disability, and Latino. However, because of those identities, he has experienced stereotyping, marginalization, and oppression. And so that's how I think of this. Other people may have other ideas around the term intersectionality.
Thank you so much, Tuara. And Cynthia, what might you add to that with, within the spaces of equity and access as well? You're on mute, by the way, Cynthia.
can I get it together? What's up? You know? So the good news is I traveled with 2 laptops. So I was able to at least get on a laptop with decent internet connection. So hopefully from here, it'll be smooth sailing. So I want to kind of frame this a little bit in terms of the whole inequity piece from kind of like a historical standpoint. I really kind of want to talk about, oppression and systemic oppression. And these are not easy things to talk about. So let me just kind of like acknowledge that, right? There are going to be a lot of people who are going to be very uncomfortable with this conversation. Some of those people are going to be uncomfortable, but understand that it is important. So folks are going to be okay kind of getting through this. There are going to be folks, and I know this because there's this feedback that I've gotten from folks who are tired of talking about race, tired of talking about systemic oppression. And to that, I say kind of like, I get it. I understand. I've been living on the receiving end of systemic oppression for 50 years, and I'm tired of experiencing it. So, I just would ask people to kind of just bear with me as I kind of set the stage as we think about how people have experienced inequities and oppression within the history of our country. And I think that it's really important to understand this because it really helps to explain a lot of the disparities that we see in society. So we have to remember and acknowledge, and this is something that, I really didn't even come to understand until later in life. I wasn't taught, the true history of our country in terms of it really being built on so many race-based laws, practices, and policies that have served to advantage some and disadvantage others. It's really not even just race. I mean, thinking about women, there are laws and practices that have disadvantaged other groups as well. But as we think about race, of course, there's slavery, there's the Indian Removal Act and the Trail of Tears, Japanese internment camps, redlining, Jim Crow, voter suppression in communities of color. In many of the legacy of many of these policies and practices as laws, remain with us to this very day. It informs how people think and perceive of others, and it informed, opportunities that people get, whether it's to access education or jobs and other opportunities. Now, let's talk about disability. It wasn't until the 70s where, we saw that people with disabilities, kids with disabilities, were required to receive a free and appropriate public education. Before that, it was, totally legal to discriminate against kids in the education setting. It wasn't until 1990 when the ADA was passed that expanded, protections for people with disabilities. So it's really important to acknowledge how these laws and policies and practices and the discrimination really that came before the protections were added have impacted us all. So, with me, in terms of my personal experience, I'm, Black, I am disabled, and I am a female. And all of those identities, all of those intersecting identities have shaped and informed how I have experienced the world and how so many others have. So I really would encourage people to think about not just the disparities, whether they be health disparities, economic disparities. Think about the disparities, but what has led to this disparities? This wasn't just by accident. And it's so unfortunate, I think, because these are issues that A, are not discussed, and B, are often framed in a way where it's not important or even safe to discuss these things. And it's almost like not discussing them. I don't know if the thought is that they're going to go away. I personally believe that a lot of it involves, wanting to maintain and hold on to power. But these are real issues. And I'll just stop there.
Thank you so much, Cynthia. I think you also speak to kind of, this huge upswing that we had in the United States and actually around the world in 2020 after George Floyd's murder around race and racial inequities. And there was this upswing where so many people were talking about it, and there was so much, kind of it felt like there was so much more space than there had been for a while. And then that space started to close a bit more. And so what I think was really great about, our racial equity series in this specific panel is that we're saying that, no, we cannot let that space close, and that we're going to keep it open. And why this conversation is important is because of the fact that we're not just talking about one identity that is disadvantaged. We're also talking about the places where oppression and systemic oppression is compounded and provides multiple layers for people who are disadvantaged in multiple areas. Christina, I'm really interested in your perspective and your experience around the need for inclusion and representation in policy for people with disabilities, especially those in marginalized racial groups. And then you also spoke about, being a first generation college graduate, which I think also speaks to largely kind of, generational wealth and also economic disadvantage. So I'm really interested. I know I just threw a whole bunch at you, some of which was not on our notes, but I just want to kind of get a little bit of your thoughts around the need for inclusion in policy as we think about these multiple perspectives.
Thanks, Dr. Carla. Well, one of the things I didn't share in my opening, specifically because I wanted to point it out in this question, is that I'm a wheelchair user. And I've been using a wheelchair for as long as I can remember. I was born with a disability that has multiple components, osteogenesis imperfecta. I'm short stature. I identify as a wheelchair user, as a little person, as a woman, as a mom, as disabled and proud. So I think all those identities are really important. But I think it's also really important to point out that I identify more with lower income socioeconomic groups because of where I've come from as well and my background. And some of the areas that I think are really important when we talk about policy and specifically healthcare policy, we're doing what we should encourage everybody to do, to bring people with lived and personal experience to the conversation, and to make sure that when we're talking about equity and we're talking about diversity, that we're bringing disability into that just as much as other marginalized communities. And that's the one piece I think I see somewhat still being a gap, depending on the conversation and what's playing out. And I'll give you an example. I, for one, never in my lifetime, my goodness, never in my lifetime had I imagined that I would have to disclose my disability. Like I said, I've been a wheelchair user my entire life. And COVID-19 has made that a reality for me and put me in a position of being able to relate to people that have had the privilege or not privilege, depending on how you would define it, of identifying as a person with a non-visible disability like you, Dr. Carla. I've never been able to experience that, but now because of COVID-19 and everything being done on screen, I don't have to identify if I don't want to. That's amazing. And I've actually tested it. So I was very fortunate to have been selected as a part of California's COVID-19 Vaccine Advisory Committee. And initially, most of the representatives on the committee did not have any idea who I was. They clearly had not looked me up. I definitely identify as disabled and proud in pretty much every public bio you could ever read on me. And yet the way they were talking about people like me, people like Cynthia with disabilities, other people in the room, you, Dr. Carla, was astonishing. 2 meetings into it, I identified as having a disability, having a disabled husband, having disabled children. The conversation changed. Suddenly, we were no more referenced as people with comorbidities, but people with disabilities that actually mattered for the first time. And I think that is a really important key takeaway me throughout COVID that shows the power of having people with lived and personal experience a part of the process. Had we not been a part of that, I don't know that the conversation would have ever changed, or that we would have been able in California to get people with disabilities of all ages prioritized for the COVID-19 vaccine on March 13th of 2021. That was impressive. I think policies and programs, services need to be catered to people that are actually going to be receiving those services or be impacted by those policies. And we can't go wrong when we invite the people with the lived experience to be a part of those efforts and those conversations to make it happen. That's really something that I believe wholeheartedly in, and what the independent living movement is all about.
Absolutely. Thank you so much, Christina, especially for that example, because, what at the very least, what representation does is it makes us check ourselves, right? So if we look around the room and we recognize that there are people there that, might look like or, have expressed that they have different experiences, lived experiences than we do, then I at least am checking my language to make sure that I am as inclusive as possible. I'm using Google to make sure I'm using the right terms, and really struggling through in that way. And so when we don't have representation, when we're not thinking from an inclusive space, then we're also not challenging ourselves to expand the conversation and to kind of check ourselves around bias. So I really want to kind of get very specific around these lived experiences. And thank you, Christina, Cynthia, and Tawara, for really sharing those from your perspective. And I also know that in your work that you are, working with people who have lived experiences, and that you're hearing about these things on a daily basis. So I'm interested in whether or not, and Cynthia, I'll start with you, if you can discuss some of the specific disparities that exist at the intersection of race and disability, especially communities of color with disabilities.
Okay, sure. I'm going to end with my personal experience, but let me kind of just throw out some things. I mean, first of all, we think about healthcare disparities, right? We think about healthcare disparities that we see with communities of color. I think that communities of color, or people with disabilities who are also Black and other marginalized groups, have kind of a double challenge in terms of thinking about the communities in which many of us live, unfortunately, don't have the same type of investments, right? So the infrastructure isn't necessarily there. So let's just say, I'll give you an example. I have a very, very good friend who used to be a personal injury attorney. And one of the things that he noticed was in the city of Detroit, predominantly Black, the bus services were not running well, A, and B, the ramps or the lifts on the buses were not working well, right? So what would happen is buses would go by, see a wheelchair user, and not stop. They would just keep on going. So what does that mean in terms of, having to make doctor's appointments, do what you need to do in terms of taking care of your health, or just your basic, family needs. So it's kind of like, I was talking about before, just this whole idea of it's okay for some people to kind of like go without. No, it's not okay. Same situation as we think about, voter suppression. And this is something that I have talked about before. One of the things that has been done in Texas is to close DMVs in areas that have large populations, highly concentrated of people of color. So what that means is they can't go to get the IDs that they need in order to vote. Because, folks have to drive now 100 or go 100, 150 miles away. Well, it's not just voting that they can't do. I mean, there's a lot that you have to do at the DMV or Secretary of State in order to get the requirements you need for transportation or to drive. So all of this has an impact on communities of color. And when you're talking about being disabled and not, having transportation options, not having, easy access, it makes things really, 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 really challenging. I will say that for me personally, I talked about, all of the work that I've done in the disability community. I have been trained. You have a little assistive technology certificate. I've got a PhD focusing, my dissertation looked at people with disabilities and assistive technology. I've done a lot of work on my own, but I'm going to tell you, and this is not something that's discussed very often within the disability community. It's very difficult for Black folks to make it working in the disability space. There are small groups that have been very welcoming and inclusive. I would say that our Anthem is definitely one of those small groups for me, but I have seen people who don't have the same credentials that I have, who don't have the same lived experience that I have, and don't have the same professional experience that I have, be handed opportunities that I was just completely and totally overlooked for. And for me, it got to the point where I thought that I needed to make a change just in terms of being able to, pursue my professional interests. So like I said, that's something that's not really talked about within the disability community. But if you take Black folks aside and ask them, they'll probably give you the lowdown on it.
Absolutely. Thank you so much. Tawara, what might you add around those specific disparities that exist at that intersection of race and disability?
Thank you, Cynthia, and also Christina for what you shared. So when I think about disparities, I think about disparities being the outcome or the product of inequities. And so I'd like to be able to make that link. And one of the frameworks that I have in terms of looking at disparities really looks at, so let's use healthcare as an example. Is it available? Is it accessible? Is it acceptable? Is it of high quality? And is it utilized? And as I think about disparities, we have to really ask ourselves, disparities in what? And not group them all together, including health disparities. And so as I think about our framework that we use to examine disparities and looking at that within this space as it relates to race and disability, a healthcare or education or mental health service may be available. It may even be accessible. However, it's not acceptable to me because it doesn't take my culture, my language, and my lived experience into consideration. And so then that goes on to impact whether or not it could also be around quality, differential quality provided to people by race, ethnicity, or under other identity factors, including disability, which then ultimately may impact utilization, which can then just continue the spiral of poor health and poor mental health and well-being. And so that is a framework to help us really think about disparities. I think the other thing that Cynthia really brought attention to is we spend a lot of time talking about social determinants of health, including the impact of disparities within that context. I encourage you to read the work of Daniel Dawes, who talks about the political determinants of health. And in that book, he discusses that for each and every social determinant of health, you can trace it back to some policy, some legislation, some decision that governs how healthcare or mental health care or education or other social services are indeed delivered. And so I think having a much broader frame in how we approach this nexus of disability and race and other identities would be very, very important. The other thing that I can think of just in terms of the research in this area and the published literature, it's very well documented, extremely well documented in health and medical care and in that literature about the biases that healthcare or the helping professions bring to their setting. And for us to be naive to think that people leave biases outside the door of any healthcare facility would indeed be very naive indeed. So in some of the work that we've done to look at documenting these biases within healthcare as stated by healthcare providers, there's a long list of things that for folks. It includes age, gender, skin color, ethnicity, race, LGBTQI identity, obesity, the type of illness, and disability. And so if we're looking at intersectionality, look at how many intersections that could indeed impact a person with a disability in terms of their healthcare experience. And so I think that that's key and critical. And then another area that I think is very important is just how the concept of disability is perceived and thought of within many, among many within the medical community. And while there's been efforts to move away from a disease-oriented, oriented perspective, we've not achieved that yet. And I'd like to just read to you a definition of disability from the 1993 amendments of the Developmental Disabilities Act. And it states, disability is a natural, I'm going to repeat that, is a natural part of the human experience and does not diminish the right of individuals with developmental disabilities to enjoy the opportunity to live independently, enjoy self-determination, make choices, which we can come back to, especially within healthcare arena about making choices, contribute to society, and experience full integration and inclusion in the economic, the political, social, cultural, and educational mainstream of American society. That's denied to way too many people with intellectual and developmental disabilities, mental health disabilities, physical disabilities, et cetera. And so again, we have to look at this from a much broader, in-depth perception to see how our experiences of people at the intersection of race, ethnicity, and disability, how are they manifested and perpetuated based on the policies that are in place, the attitudes within our health and mental health care systems that really impact the health and well-being of each and every person.
Thank you. I really love that you shared that definition, Tuara, because it also just kind of reminded me of, you know, all of our, if we look at this, all of our abilities to kind of have life, liberty, and the pursuit of happiness. Is that something that we can say is equitable? Can we say that there is equal access? And what resources are we providing individually in our work to make sure that that is something that everyone, every human being can realize? You also talked about bias, and I really appreciate that segue. Christina, I want to ask you about these biases. What role does bias play in providing equitable services to people with disabilities?
That's such a good question, Dr. Carla. So, oh goodness, I think the biases that I have experienced as a mother with a disability have been outweigh what my experiences were just as a woman with a disability. The biases I face from just getting pregnant. I'm a very proactive, organized type person. Anybody who knows me knows that I always like to have a plan for everything. And so when my husband and I chose to be parents, I said, you know what, we need to proactively find a physician that's going to be a part of our team and understand that if our child is born with a disability, we're going to be completely fine with that. And we want to make sure they're going to be completely fine with that. And it took 3 rounds of interviews, which doesn't seem like a lot, but 3 rounds interviews to find a physician that would actually support me becoming pregnant because of the biases of me being a wheelchair user and having a genetic disability that I could pass on, but my husband also having a genetic disability that he could pass on. And we had this really interesting experience when we finally got to the physician that we absolutely love. She actually was the physician through both of my pregnancies. When I was in my third trimester, I was seeing, you could only imagine all of the different physicians on my team. Like we're talking everybody from A to Z is going to be on this pregnancy team. And that was okay. I didn't consider myself that much of a high-risk pregnancy, but medical industry certainly thought I was high-risk pregnancy. But during my third trimester, after everybody knew that we were completely comfortable with having a child with a disability, they noticed in utero that my daughter, her brain wasn't forming correctly. And they weren't sure why, but they were running all these tests and they weren't quite coming out with it openly. And I lived about an hour away from my physician's office. And I had a exam one day by a substitute physician that was there that day. And the following day they called and said, "Can you come into the office?" And I said, well, I'm an hour away and I have to work tomorrow. Is this something we can just discuss over the telephone? And they said, "Let me call you back in an hour." And I had the most interesting experience. So while my husband and I both have physical disabilities, and we had definitely informed our team that having a disabled child wasn't going to be an issue, we weren't going to do an amnio, whatever happens, happens. We had that 1 hour phone conversation where the doctor said, "We think you might want to consider terminating. Your child is going to have a significant developmental disability." And it was that they thought was okay to have a terminated pregnancy. They thought in their minds, and this was discussed obviously, that when we said that we were okay having a disabled child, that we were okay having a disabled child if they were like us, but not a child with a different type of disability. So there was that bias. But Olivia needed a number of different health supports when she was born. And one of the things that I've never been able to, really walk away from, it's somewhat emotional to talk about, but Olivia had a shunt put in her head when she was about 4 months old. And I couldn't see her in the hospital bed because things as simple as a hospital bed are not accessible for wheelchair users, let alone wheelchair users, moms in wheelchairs, to be able to see their babies. And so I think about simple things like that people take for granted, that we need to think about how our biases and how our stereotypes and how we're marginalizing people from top to bottom in so many different ways on a daily basis that impact everyone's life based on their experiences. And I'm sorry for getting emotional about that, but it's something that really impacts me.
Yes, and I don't you dare apologize for your emotions. This is the space for them, and this is actually also showing not only your humanity, but the side of humanity that we tend to miss when we allow our biases to lead. So so to think about your experience the next time we even look at a hospital bed, that even the times that we think about this conversation that you had to endure, this trauma that you carry, these are the parts that we should be searching for, so that we can know the humanity that is here. We're not just talking about policy that is just written into law just because. We're talking about the people on the receiving end of that access. And so, Christina, I 100% am humbled and so appreciate your story, and for adding the experience of people who are pregnant, who are also people with disabilities. And so, then we add a layer for me personally as a Black mom with a non-visible disability, and knowing the statistics, especially in Georgia, especially in the United States, of what could happen, right? And as you said, having to endure various doctors who are not even aware of what could be the impact, the human impact of being a person where there is an increased mortality rate for birthing a child. So I not only appreciate that, it also, makes me think about, again, more examples in the healthcare system, and then also as we work as providers. So Tuara, I also want to ask you about the biases as you expanded on them. I'm wondering about this role that you've seen bias play in providing equitable service or lack thereof to people with disabilities, especially as we discuss the added burden that these biases place on historically marginalized communities of color.
Where to start? Okay. Obviously we can speak to unconscious biases, and also those that are explicit. And there are many times within healthcare, mental health care, that there are explicit biases that they are articulated by those in the helping professions about people who have disabilities in general. And oftentimes for people with disabilities from specific racial, ethnic, and other identity groups. And this may indeed include how much time it takes to provide for their care. It can also include because someone has a physical disability that for some reason, someone also may think that they have some cognitive problems. And so that they're talking down to that person. Biases around, again, this notion that disability occurs. It happens. It can happen at birth. It can happen by accident. It can happen because of any number of factors. But again, it doesn't diminish who a person is. I think that what we saw for about biases was well documented during COVID, that there were decisions made and articulated and published in our newspapers around who deserves care, who deserves to get a ventilator, and statements about the worth of someone's life because they have a disability. So I think that a fundamental bias is again, the humanity of people with disabilities that may be forgotten by some within health and mental health care, and that their lives aren't as valuable. Even things such as don't experience pain the same way. Some of the work that we do at Georgetown includes parents who have intellectual disabilities. And the biases that we encounter supporting these parents are paramount. It's not just in healthcare or mental health care. It's across the social service systems. And we have a national grant now to look at how can we begin to change some of those practices. But those practices are embedded within ourselves as human beings. And then they're reflected in our policies and practices. And without using a critical eye to examine why we behave the way we do, why we assign certain labels to certain groups of people, why we deliver care in a particular way to certain groups of people, that we really remained in a spot where we will continue to perpetuate those same kinds of stereotypes, same kinds of discrimination, and same kinds of oppression. And there's a lot in the literature about this. And so as I think about how our physicians are educated, how much time is spent on disability as opposed to a course or a couple of sessions, but to really use that lens of disability as a natural occurrence in life. and that it can be temporary and or it could be permanent, but it's part of the healthcare, mental health care experience. So again, I mean, there's an abundance of literature that speaks to this and the kinds of experiences that people have, from women who are wheelchair users not being able to get mammograms because of the equipment is not accessible. So, you know, that's not about this individual technician who wants to help. This is about how we design is in the physical environment, how we think about accessibility. So I think that the biases are on multiple levels overall. So it's at a systemic level. It's at organizational level. It's at community level, because, you know, as we think about, we had to enact laws in order to get curb cuts. We had to enact laws in order for kids with disabilities to be able to go to school. So this is a lot about who we are as a society and how we view disability.
Absolutely. We had to enact laws and have decisions that allowed people to not be institutionalized because of a disability and be put away out of our sight. So we're talking about a pervasive issue. We're talking about a pervasive issue of ableism, of racism, of biases around race, disabilities, and then pervasive just misrepresentation and ignoring and rendering invisible the disparities that exist, the systemic oppression that exists because of racism and ableism. So I kind of want us to really dig into why might we, make the distinction between experiences of people of color with disabilities and experiences of non-Hispanic white people with disabilities. Why would we even make this distinction? Cynthia, you are off mute, so you go first.
Thank you. So I want to be cautious in terms of how I respond, just in terms of it's tough to compare groups, right? I think, though, when we think about things historically, people of color have faced, as we talked about before, systemic issues, right? So there is bias that exists against all people with disabilities. That's very clear. People of color experience an additional layer of challenges, biases, experiences that come with race. That's undeniable. And so I think that it is really important to not say, well, exclude some, include others when we're thinking about who needs services, who needs support. I think that it's important to think about populations, and to think about what are the unique experiences that certain populations have to help guide the type of support that is needed. We're all equal here, right? It's a matter of different populations have experienced different things, which leads to just different circumstances. And I think that acknowledging that is really, really important.
Absolutely. Acknowledgement is important. And Christina, you spoke earlier about, representation. And so what we know is that the disability movement has been largely led by non-Hispanic white folks. So can you help me and help us understand, what might be added if you could look around the table and see people of color who also have disabilities as well? What might be added to those conversations?
Such a good question, Dr. Carla. I would, first, I want to just say that, yes, that's a big topic of conversation in the disability community. And there's an entire hashtag disability to white. that's been going around for quite some time. And I think that on many levels, all levels, there needs to be a conversation that and a dialogue, and not just one. I mean, I've seen the one-offs and it's nice to see, but they need to continue to happen on a regular basis. And so when I see national disability organizations saying that, you know, they want to be equitable, they want to be more inclusive, they want to be more diverse, they want to make sure that, you know, it's not just white people led, then I want to see the practice that's actually being put towards making that happen. And one-off conversations isn't what that's going to do. So I think really embracing it, putting together a plan of what that really means, and ensuring that people of color want to be a part of the conversation, for one, and for two, that they are a part of the conversation. And, you know, I am probably not the best person to speak on that specific topic, but I would just say that there's plenty of room for that conversation to take place on multiple levels.
Absolutely.
And can I just
Of course.
add to this? I would say when we think about this issue from a systems level, there is a long way to go when we talk about inclusion of people of color in the disability community. I would say, though, that on an individual level, there are people who are behind the scenes who are speaking up on behalf of people of color, which I know for a fact. You know, names that come to mind, you know, Maria Townsend, Rebecca Coakley, Meryl. I mean, there are people who are doing what's within their capacity to do. You know, one of my favorite sayings is, you can't do everything, but you can do something. Try not to let what you can't do get in the way of what you can do. And so I would just encourage people who are listening, you might not necessarily be able to change an entire system, but you'll be in a situation where you can speak up as an ally on behalf of somebody who's not necessarily in the room. So I would really encourage you to use your voice and speak up as an ally to try to really create a more fair and equitable society for us all.
Absolutely. Yeah, go ahead. Of course, Twara.
Yeah, I'm just kind of reflecting on the statement about disability to white, and this, it may sound somewhat cynical, but why would we expect the experiences of persons from specific racial and ethnic groups other than non-Hispanic white who have disabilities to be different than those of people without disabilities from those same racial and ethnic groups? Okay, so, you know, I'm kind of stuck there because we live in the United States of America, and those experiences are pervasive across race, ethnicity, gender identity and expression, and socioeconomic and other factors. So what I think is different is that they are compounded because of disability. And so I think that that's really important. But the other is, I think about the statement of disability to white hashtag, is that it really is speaking to the power dynamics. It's the power dynamics within our country. And many of the disability organizations are led by and work on behalf of persons who are non-Hispanic white, and that they've not been good about including the interests and needs of persons from specific racial and ethnic groups. So I would just say, and it sounds cynical, it's not surprising, it is absolutely predictable. And so I think that what we've seen emerging, and again, I have, if you bear with me, I just want to talk about this within disability segments of the disability communities across the country. The concept of disability justice has emerged. And it's a very powerful framework. And if you would allow me, I'd like to be able to share that with you. that disability justice is across disability, sensory, intellectual, mental health, psychiatric, neurodiversity, physical mobility, and learning. And it's a framework that values access, self-determination, and an expectance of difference. So in other words, we all are human beings, and we are all different. And so it's saying that we should accept difference in those spaces. An expectation of difference means that we can expect difference in disability, identity, and culture. To be included in part of a society is about being able to be our whole selves, all of our identities together. Disability justice includes a space for self-care, reflection, and heard discussions. What particularly moved me about this framework or definition of disability justice is this: disability justice redefines beliefs about productivity, but this one, attractiveness, and the value of human life. Beyond challenging what is considered normal, disability justice addresses the deeply held fear of vulnerability by practicing the value and act of interdependence. A group of people with disabilities in 2014, the Disability Activist Collective, came up with this framework. And it is different than equity because it's specifically talking about justice.
I really appreciate kind of the inclusion of justice work and making the distinction between, what is justice and what is equity. So I really appreciate that addition.
Can I just chime in on one
Of
thing,
course.
just in terms of that really important point, I would say, about power. And it's really interesting in that I just heard a statistic not too long ago. I think about our society being so incredibly segregated, and the kind of natural inclination to gravitate toward people who are like ourselves. And when the people in position of power are doing that, and that's something that everybody does, but when people in the position of power are doing it, it serves to, disadvantage others who are not like them, right? So the statistic that I was referencing is that, white folks have social networks that are 93% white. So we're talking about, folks in positions of power, 93% white, 75% of white folks have networks with zero minority presence. And so I say that just to say that I would really encourage folks to do what you can to expand your networks. It's really interesting. I was talking to somebody who was a white male speaking at a conference with all Black folks. And he was happy to have the opportunity to engage with folks who were not like him. He's a very kind-spirited and nice person. But the way that he spoke about it, entering this space required a lot of thought. It required a lot of strategy. He was nervous. And this is in a professional setting. He was nervous. And it's just interesting because as Black folks, even the conference where I am right now, that's our life. We always navigate these spaces, right, with people who are not like us. And we have to do it in a way to kind of, fit in and have people feel comfortable with us. Then add to that the whole disability piece. And it's really, we learn to navigate, but it really, to me, kind of like raises a lot of questions about, really being able to show up as your authentic self. If we always say, oh, show up as your authentic, yeah, you really don't want to see my authentic self. I am putting on a show for you to make you feel comfortable. But I just wanted to kind of put that out there, kind of just as additional I would say, kind of situations and scenarios that people of color and people of color who also have disabilities have to face with a challenge. It's interesting because I'm hearing somebody say, I'm white with no power. I would say I'm Black, and in situations I do have power, just in terms of it depends on what the situation is. So I'm very intrigued by that comment.
Oh, may I comment on that just a little bit?
Of course, yes.
A really great quote from Alice Walker, and it basically says that most people fail to realize their power by thinking they don't have any.
Mm-hmm.
And so in my work, I like to use this framework that says to really think about what do you have power over,
Mm-hmm.
and really think about what do you have power over, what do you have power to, meaning what do you have power to do, what do you have power within, because that's important, and then what do you have power with. And so if you think about power from that perspective, it's really key and critical. And sometimes you may not have, quote, the formal power, but leaders, and that would be leading from any seat, have the power to influence. And so I think if we revisit power, or to think about the multiple aspects of power, we may indeed get very different decisions.
And I will say it's really interesting because I'm at a Web3 conference, and one of the big things within Web3 is that, oh, it's the great equalizer because you can operate under this cloak of anonymity. So nobody has to know, what you look like, or, when you're online in the Web3 space. And my response is yes, and should people of color be limited to situations, and people with disabilities be limited to situations where they have to operate under this cloak of anonymity in order to be successful and be, we're all here in real life. So this whole thing about being anonymous, isn't going to fly for everybody. But my point in saying that is that, and there was a comment that was sent to just the panelists, when you are a member of the dominant culture in the United States is white, just by showing up as such, you have a certain level of power that other people don't have. Just the fact that you're not going to be discriminated against based on race, that there's something to that. So I say this in the spirit of trying to just explain and have a conversation, and not to demean and degrade. So please take that in the spirit in which it was intended.
Carla, I just one more thing really quickly. So we've talked about this. We've talked about intersectionality, and we've talked about the nexus between disability and race. And for many people, obviously, it's inseparable. I just want to share something. When we think about defining racial equity is really the condition that will be achieved if one's racial identity no longer predicted in a statistical sense how one fares. So then if we take that and we think about ableism, and we could look at disability equity is the condition that would be achieved if one's disability no longer predicted or be a predictor of the individual or group outcomes. And then you have to merge that, because we're not just talking about disability. We're not just talking about race. We are talking about intersectionality. And I think that it's perhaps a hard concept to grasp, but we have to be able to understand and merge that, because there are differential experiences based on one's race, one's gender identity expression. We also know from data that most people in the United States who have significant disabilities are poor. So that's looking at income. Many people with disabilities continue to live in congregate settings, although many still live at home. And so if we think about all of those dynamics, it looks differently by community and by race and ethnicity and by income. And so having a really broad view of how we examine data, how we disaggregate data to get a truer picture of who's walking in the door to get healthcare and what their lived experience actually is.
Absolutely. Thank you so much for that. And I want to, this has quickly turned into a part one because obviously we have so much more to talk about. So, we have about 10 minutes, and I'd really love, and Christina, I'll start with you. I'd really love for you all to, as we think toward a part two, it's already formulating in my head around how we can really dig into what providers, what educators, what human beings should be doing about this. So, huge question. So we'll just kind of start here, but what are some of the things that you suggest we do as we leave from this conversation today, as providers, educators, leaders, parents, siblings, all the things, right? What do we do? What's something that we can start and do to really dig in to this work around looking at the complexities, especially for people with disabilities and people of color with disabilities? Go ahead, Christina, you can start.
Yeah, wow, I feel incredibly privileged to just be on this panel with these two women. They are amazing. Thank you both. This has been incredible. I think for me, it may seem very basic, but one of my basic fundamental rules is, do we reflect who we are providing services to, who we're creating policies for? So I don't know if that's just me, or if that's just a basic rule that I think most of my friends follow, at least, where we need to look and see, does our office, does our industry reflect the community in which we're serving? And start there and figure out, what do we need to do to get there? And I mean, a big change for me coming from disability world to a healthcare world at Anthem was, I said, I think the scariest thing for me is going to be going from a all disability world where things are automatically almost accessible for me in disability rights, to coming to healthcare, which I'm obviously very extremely passionate about healthcare advocacy and policy, being at a healthcare conference where I'm like, wonder how people feel about me as a wheelchair user rolling around this conference, and do they see me as a patient more than a colleague, or what does that look like? So thinking about that in reference to, does your company reflect the community you're serving? And if it does or doesn't, how are you working towards making that happen? And how are you, again, another basic, have you done a SWOT analysis to determine what the strengths, weaknesses, opportunities, and threats are to your company after you've maybe done that reflection? And then I always go to, what does the community say? What does the community want? Those are my three basics of where I would start.
I love that. That's such tangible work that we can do right now. Thank you so much, Christina. Tuara, I want to head over to you to answer the same question. What do we do? What do we do with this information? How can we continue the work? You're on mute, by the way.
All right. Sometimes my mouse doesn't cooperate. What do we do? That's huge question. And I don't want to give like an answer that's not substantive. Okay, so I would say that I think that we have to really look at what can we do individually, meaning assessing our own understanding of of intersectionality and what that means, whether it's in healthcare or mental health care or ranges of social services. I think that so we have to at least start at that level, and to continue to acquire knowledge around that experience from a variety of sources, including, most importantly, from the people to whom you provide care and support. I think that then we would want to look at, again, what do we have power over? Power over self. So how am I advocating for the interests and needs of this population? That's another thing that we can do, because this isn't going away in my lifetime. I'm not even sure in my grandchildren's lifetime that is what we would see. I think that we can use our voice as advocates. And I think that we have to be proponents of change. And that also means understanding our role as leaders. And my understanding really of leaders is that you can influence and mobilize people toward change. Does it mean you have an appointed leadership position? There are many people who are in leadership positions who are not leaders. They're just in leadership positions. And so I just think that when I look at things, it's the individual level, it's a community level, and it's the larger, broader level. And what is it that you can do as one person in each of those arenas to begin to affect change? But it starts with self.
Thank you so much. And Cynthia, I'd like to offer you space to also give us some actionable steps for us after we get off this call. And also Tawara and Christina, if you can also add, while we're wrapping up, your contact information, ways people can get in connection with you. Cynthia, you can do the same once you have a moment.
Sure. Well, first of all, just being here for this hour-and-a-half long conversation, I think is a really great step for all of us. And so really, I appreciate you all putting this on. This has been amazing. My big thing is expanding networks. I mean, I know that, some folks might think differently, but I'm just really into trying to get to know people who are not like me. I try to listen for understanding, and I appreciate when other people listen to me for understanding. So I think that those are all really important things. One group that I am a part of, it's like a professional development group. It's called the Interracial Sisterhood Coalition. It's run by a woman named Karen Fleischman, who runs Racy Conversations. And for me, it's really been helpful just in terms of trying to understand the perspectives of others, getting to know different people from different backgrounds. And really, it's a lot about identifying, shared and common interests. Oftentimes I have found when you really look at the core of people, most of us want the same things, right? I think that it's really a matter of getting to know folks and allowing people to get to know us, and us working together in order for us all to make progress. Because I want us all to win, right? And we've got to work together.
We do. And I think that is a great place for us to stop. I want to thank you and share my appreciation to Tawara, to Christina, to Cynthia, and also to both of our ASL interpreters. We are so appreciative of you all being here and being part of the conversation. And we have to continue this conversation. Meryl, you want to take us home? You're on mute. I'm sorry.
No, maybe I should be sorry. I wish I could say this was the first Zoom call I've done today. No, I actually don't want to take us home. I would love for us to be able to just to do a day-long discussion, right? And bring more people into it. I have cried. I have laughed. I have taken notes. I have been touched. I've been move to say, what is my commitment? Sometimes as an ally, sometimes as a person with a disability. And so I think I don't think there's anybody who's been listening, right, that can't take some of just the range of emotion, but what can we do, right, to be more inclusive and to drive to a more inclusive, equitable, and just community for all of us. I think, like Cynthia said, most of us really kind of want the same thing. And how do we get there? Because the silos are so tough. So we started to touch on those today. We got some resources in here. I can see Rachel is reminding us to make sure that that survey is filled out. Please put your ideas in for our next forum. They are quarterly. So we would be thinking, what is this, June? Yes, June 22nd. A reminder on Happy Olmsted Day. Let's move towards more community inclusion. And then July, August, September. So yeah, we're back to September with a new forum. Keep your ears out for that and let us know what's important to you. Thank you to our participants, but to the panel, my gratitude. Just being on the panel with you is amazing. Being friends with you is priceless. So thank you, everyone. Have a great rest of your day. Stay well. And we will see you in 3 months.
Thank you, everybody.